Hey everybody, this is Mike Mutka at Straightaway. We're going to start in about 2 or 3 more minutes. We're just giving a few more people a chance to log in here. So we'll be starting in a couple minutes here. All right, everybody, we're going to get started here today. Thanks for joining us. And today we have a special treat for you. We are joined by Sherry Johnson. Sherry is our new Chief Clinical Officer at Straightaway, and she's got a really great background. We're excited to have her with us. She was most recently the VP of Education and Operational Support for Pruitt Healthcare in Atlanta. And she has a master's in nursing with a focus on education, and has been on our Straightaway advisory board for a number of years. And we're really excited to have her as our Chief Clinical Officer, helping us ensure the integrity of our clinical content at Straightaway. She has a special interest, a passion for frontline training and instructional development in particular, and she's going to talk a little bit more about her background and how that relates to her upcoming blog series that we're excited about. So Sherry, I'm going to turn it over to you.
Thanks, Mike. Welcome everybody. Glad to be here with you today. So just a little bit about me. As Mike said, I'm a nurse, certainly. I started as a nursing assistant in long-term care and absolutely loved it. Fell in love with taking care of the residents and being in the nursing environment. So I've been a nurse for, more than 30 years. And like many, I kind of can break my career or my practice down into some distinct phases. Early on, when I first got out of school, I worked in the intensive care unit and emergency room. I was a trauma nurse specialist. I did that and just really learned a lot during that time. Certainly the clinical skills and that grounding and the things that you need to know. But I also learned a lot about systems. I learned that when you've got a patient and they're on a vent and you have to adjust their dopamine drip because of their blood pressure, well, that affects their kidneys, which affects their breathing, and it all was so interrelated. So it really taught me a lot about systems, and that when you make a tweak one place, there's implications somewhere else. And that's certainly been a skill that I've carried with me through my career, and I think has served me well. But it was really early on that I learned those things, and that was interesting to learn. I also did travel nursing and worked in Hawaii and Washington, D.C., and saw the differences in the scopes of practice that nursing had around the country and the ways that nurses approach things. Certainly fundamentals were the same, but it gave me a broader sense of the fact that we have such a wide array of practice standards and the way we approach things with our patient care. The next several years, I worked with the American Red Cross, starting as a head nurse in one of their blood centers. I moved then into project management and was the action officer for their manufacturing and computer standardization initiative. And from there, then I went into training and development. And this was for frontline supervisors and managers. We had a really great program where we equipped those sometimes new managers and supervisors with the skills they needed for people management and scheduling and conflict management and just running a good blood drive to the processes that they would need. So it was a really good program. And then, as Mike said, most recently I worked back in the post-acute care and long-term care sector, which to me, was more like coming home. That's where I started, as a nursing assistant, and then came back and have really loved it. So along with the education of the front line, certainly I had a team of educators, and we worked on clinical skills, CNA training, and a lot of train the trainer. And what I found that I really loved was working with educators, helping them get the skills that they needed to take those, either the practical or the tactical or the clinical skills back to the facilities to work with their staff, either the nursing assistants or the nurses, but to really give them the resources to empower them to be better as instructors. And that was just really kind of my wheelhouse of the best part of my job that I enjoyed there. That's a little bit about my background. The upcoming blog series that we're going to write and that I'm excited to share with you, the topics over the series of 4 weeks in February will be kind of the new nursing education leader. What do you need in that role? What's that transition to practice? Going from a clinician to an instructor, that's sometimes a big change, or even to a nurse leader, that's a big change. So I'll offer some practical tips on how to make that a successful transition and some things that you can use in your new role there. The next topic I'm going to write about is survey response. When you have your state surveys and you get your 2567, let's say you've had some negative outcomes and not things that you were hoping for. Well, often the first response that we hear is, let's re-educate. Let's get that education back out. We know that's what the surveyors want, and then we'll all be okay. Well, sometimes that's the right answer. But one of the things I'm going to share with you is how to really target what that education can look like to be effective and meaningful. We'll talk about Miller's model of clinical competence and how you can help to determine what level of education that you need to implement to get those results that you really want to strive for the excellence in patient care. The next topic I'm going to write about is preventing rehospitalization and how competency management can help. Oftentimes, we react to situations. We always feel like we're a step behind. So we'll talk about really putting systems in place and how a competency management system can help you in the whole initiative of preventing rehospitalization and providing great patient care and resident care. And then finally talk about preceptors and building that strong team. As both nurse managers, administrators, and nurse educators, you can't be there 24 hours a day, 7 days a week. So you have to build a kind of a wider network, and maybe you're thinking in terms of your unit managers or your supervisors, but how preceptors can have such an integral part into being a successful facility and having great, staff that are engaged, as well as great resident care and outcomes. So that's kind of what we've got coming up. Mike, I think I'll turn it back to you.
Awesome. Thank you so much, Sherry. And let's see here. The questions are starting to pop up. And the first question I have is, how come when I do one of these, nobody ever asks this many questions? That's what I want to know, Sherry. And, that's something I'm going to have to reflect on that a little bit later on. But the first question that's come across here is, what is the best leadership advice you've ever received? Best leadership advice you've ever received?
Oh, that's a great question. Early on in one of my first kind of leadership roles, I was the house supervisor of a community hospital, and the administrator was very impactful to me. He actually had his organizational chart, the table of organization of, who's who and who does what, and he had it flipped, where as the CEO, he was at the bottom of the org chart, and he really imparted to me that servant leadership is so important, that the people that are the most important in his organization were those at the top, which were the patients and the community, then the frontline caregivers, the CNAs, the office staff, the people helping with admissions. Then you got into your nurses and your leaders and your department heads. And he really stressed how his job was to make sure those people at the top of the organization had what they needed to deliver the patient care. And so that's probably the best advice I've ever received, was to really look at the needs of those people closest to the ones touching your residents and patients.
That is good advice, and advice I would put into the category of simple, but not to be confused with easy. Very straightforward advice, but not always easy to make sure you're making time and prioritizing to execute on that. So before I go, there's another question here. Before I do that, I just want to make sure everybody knows, if this is your first time doing this, there should be a little box or window up in your right-hand corner, and there is a questions box. You can go in there and you can put a question in, and it will come to us, and we can put it in the queue. Just want to make sure everybody knows that. So here's another question, kind of piggybacking off of the leadership advice here. I'm new in my role as a staff development director. What are the most important tips you can give me to be successful?
Okay, that's a good one too.
No pressure. No pressure. This is somebody's career is on the line here, and it's somebody from Georgia here too, interestingly. So no pressure at all.
Oh yeah, none taken. So I think I would say, really don't forget the skills that you have. Sometimes when you're into a new role and you're new, especially in the staff development role, you're really comfortable in that clinical role. You know how to take great care of the residents, and that's where your comfort zone is. But now as the leader in the education area, you're really have to go out and make sure that your staff know what they're doing, and you're going to provide leadership and guidance for them. So I guess a couple things I'd say is find a mentor, find somebody that you really respect, that you can lean on when you have questions or you're not sure about something, you can ask them, or that you can model because you really like the way they do things. It's really easy to feel like you're isolated. As a staff development director, you're probably the only one in your facility that has that role. And so it's easy to get isolated and feel like the whole weight of the world is on you. So kind of don't fall into that. So find a mentor, take classes. You know, when you were a young nurse or a new nurse, maybe you took classes after you got out of school because you wanted to learn more. Well, now that you're in this role, take classes on education. Find some train-the-trainer classes. Find some anything that'll help you feel more confident. And then I guess I'd also say find a community, either through your State Nurses Association or other organizations, or just nurse educators that you know. Find a good group that you can piggyback off of with ideas and sharing resources. That will really help you feel successful and build those confidence skills that you need. The other thing is there's a professional organization called the Association for Nursing Professional Development, which is a great organization. I'd recommend that you join. They have monthly webinars for their members with giving you the skills and resources that you need in your role. So that's another tip I might give.
That's good advice. And somebody else came and piggybacked there and said, any good leadership content or books you lean on or find yourself continually going back to, books or TED Talks or individuals at all. And I know for me, just a real simple one, the 1 Minute Manager series and Leadership in the 1 Minute Manager, which has been around for a lot of years, has always been a really good one. And from an organizational standpoint, at Relias and at Straightaway, we've used the book The Advantage by Patrick Lencioni, which is really more about organizational health. But anybody out there that you've found yourself finding relevant in terms of leadership content?
Probably, I go back often to Mary Harper. She's been a big-time writer and leader in the Association for Nursing Professional Development. So they have a couple books that I have used and recommended. One is just Getting Started in Nursing Professional Development. They also have the Scope and Standards of Practice. That is a good resource. You can't go wrong with, any of the Benner model, which is the novice to expert. The other thing is often I go back to, it's really just some simple books from just the American Nurses Association. They've got a lot of good leadership development materials and webinars. So those are probably the ones I use mostly for nursing. But leadership-wise, boy, yeah, Patrick Lencioni, you can't go wrong there.
Yeah, I agree. Somebody had asked to clarify, again, what was the name of the organization you referred to for staff development professionals?
Oh, yeah, it's ANPD, which is the Association for Nursing Professional Development.
Association for Nursing Professional Development, the ANPD. Okay, great. Let's see what else is coming across the ticker here. Well, you kind of covered this already, resources. So hopefully your answer kind of covered this question came around the same time. What resources have you used? Well, this is what resources have you used to help get better as an educator, specifically as an educator rather than leadership? Is there anything out there that's been really helpful for you?
There probably has been. Really, the one thing that helped me just get back into it was when I went back to school working on my master's, because it forced me to read and see a lot of things that were current. So any kind of classes or workshops that you can get back into, I think really help with just re-engaging that learning part of your brain to find new skills. I mean, it's really basic, but the Stephen Covey 7 Habits of Highly Effective People, I think was a book that really helped me in remembering, kind of looking at the big picture of things and then breaking it down. He was somebody that really influenced me.
Okay. Dang, for a minute there, I thought we had stumped Sherry. I was like, have we done it? Okay. And then you pulled it out. You pulled it out there. Anything you would say are the biggest challenges for a clinician in their first leadership or supervisory role? Biggest challenges, typically, for a first time.
The biggest challenges are probably time management. It's overwhelming sometimes, all of the new responsibilities that you have, and you're not sure where to focus or target, and it can be really overwhelming. So you find yourself working 10, 12, 14 hours a day. If you're not physically at the place you work, you take it home with you because it's so much to absorb. So I think one of the challenges in that part of it is to really find some balance in either physical exercise, getting out, taking walks, doing something that'll break up that sense of hurry and that urgency that you feel to know it all and learn so much so fast. I think that's one of the challenges a lot of first-time leaders have in that transition.
That makes sense too. Yeah, for the clinician also, especially if somebody has moved in that position in part because they are so excellent clinically and a perfectionist and really have high standards, there could definitely be a tendency to want to try to, dive into everything and try to power through it all and lose balance.
Absolutely. Yeah, it happens.
Go ahead.
It's really easy to happen. No, I said it does happen a lot, and then you have that risk of burnout. So that's why I really stress it's so important to take that step back and not let yourself get so consumed that all you do is work.
Okay, and I think it looks like we covered all of the questions here. All right, so that wraps us up for today, and then again, Sherry will be, the topic she talked about today, she's going to be diving into in more detail in the regular blog series that's coming up. we just wanted to kind of give you a little bit of a sneak preview. And thanks, everybody, for joining us. And hope to see you out at the Straightaway website, checking out our Sherry's blog topics.
Thanks, everybody.
Have a good one. All right. Bye-bye.